Rob, today is a special day. We are going to talk about you. I mean, not you specifically, but it's time to talk
Oh,
about the men. We spent
yeah, I know.
so
I am
so
kind of where
much.
you're going with that. I was a little worried at first, but you're absolutely right. Talking about men's health and proactive men's health.
Right on. We've got some great speakers coming in today, and we're so happy to shine the light on what it would take for an employer to build a proactive and preventative workplace that helps men get the help that they need in a timely manner. So let's bring them in.
Well, Caroline, it's great to have two of my favorite ladies, a dynamic duo from Equitable Life, Sophia and Megan, on our call today to talk a little about an important topic that, it's more especially around proactive healthcare, and that comes to like men's health. And being a man myself, obviously, that I can speak to that. Like there's a lot of times that men will have kind of delayed care or being reactive instead of proactive. So I'm really excited for our discussion today. And maybe to kick it off, why don't we start, Sophia, with yourself and just introduce yourself and a little your background, your role with Equitable Life.
Sure. So Sophia Colaiacovo, I lead the sales team for Eastern Canada, which at Equitable is Ontario to Atlantic Canada. I just celebrated 21 years with the company on the 4th
Hey,
of
hey.
July. Yeah. And yeah, I think I'm going to borrow Megan's like self-diagnosed benefits nerd description, but I think the longer you spend in this industry, the more exciting it becomes because no day is the same and you're always learning. And I think the fact that we're talking about things more from a preventative perspective is really a good change, because I think when I started the industry, it was a lot more about reacting to things. And so I'm just looking forward to chatting with you guys today. So thanks for having us.
Well said. Thank you. And Megan?
Yeah, thanks for having us today. I'm Meghan Vallis. I'm the Western leader for Equitable, which is Manitoba through BC. I've been in the industry 20 years. I've been with Equitable for 6, having a really great time. We're up to a lot of really cool stuff right now, so it's been great. I'm really excited to talk about this topic. And whatever I do, I kind of always like to preface, like, Megan, Sophia, what do you know about men's health? And like, the fact is we don't have that firsthand lived experience like you do, Rob. But I think it's really intentional that at Equitable, Sophia and I are talking about men's health. We've got a lot of great men on the leadership team that could be championing this, and they are. But we're kind of the head voice because it's important for people to be comfortable talking about healthcare. Period, regardless of what that is. We need to get comfortable with maybe some uncomfortable topics. We have a lot of advisors in the industry who are men. We have a lot of contacts in employers that are women, and we need men to talk to women about women's health and men's health, and vice versa. And so I think we're just kind of trying to lead by example of just everyone talking about health. Period, doesn't need to be doesn't always have to be first-hand lived experience to speak to something.
Love it. Well said. Well said. And I think that's important, right? That first of all, I love that all four of us are benefit nerds, that we love and live and breathe. And you're right. And companies have more options that I think today than ever before when it comes to being proactive with their benefits plan. So I'm really excited for today's conversation.
Yeah. And I will say a big kudos because I still remember I was in my car driving. We were talking about topics that we should develop. And I think we all suddenly agreed that there's a lot of resources and a lot of discussion around women's health. We've all seen a lot of support come out with developing programs for menopause in the workplace and analyzing claims from women and what to do about that. And we all paused and said, what about the men? So, and Sophia, Megan, kudos to you both because you took that away and you've developed, some great content. And so I'm really excited. So, let's start off with, why is now the right time to focus on men's health?
I think you kind of nailed it. Women's health has been in the spotlight for a number of years now, and it really needed to be. And frankly, still does. We need to continue that conversation going. It can't drop off. But there are a lot of different, types of organizations that are leading the charge here. And every time we're kind of out and about, we were getting that feedback of, look, what about the men? We need to know what's going on with them. We need to know how to help them, in our workforce. And so we just kept hearing like the what about the men. And so we wanted to lead the charge on that. We're kind of first out of the gate starting to talk about men's health, earlier this year when we kicked it off at the Benefit Alliance conference. And we're starting to see now other organizations talking about men's health a bit more. So I think it's just a great time to bring them into the conversation since the women's health side of thing is well supported and continues to be well supported.
Yeah, and first of all, from a women's health perspective, I couldn't agree with you more. We've loved the podcast that we've done around recognizing a lot of solutions in the marketplace right now that are available to employers. So when it comes to now talking about men's health, I think a big one is, men waiting to seek care. And I know, Megan, you've done a lot of research and studies. And for those on LinkedIn, Megan's a great follow on LinkedIn. But what does the data actually show us about men avoiding doctors or some of the delay symptoms that you see, Megan?
Yeah, it's really the data's kind of interesting here. First, we have a family physician challenge in general. Everybody has challenges seeking care through a family physician, your primary care. But men are really waiting even when they have a physician. So the studies show that 65% of men waited more than 6 days when they have symptoms before visiting a doctor, and almost 30% actually waited more than a month. That's a really long time to be waiting to see a physician. More women than men actually have a family physician as well. And so I'm sure that doesn't help, them seeking care. But they're not seeking care even when they have it. There's a lot of people have access to virtual care. More women use virtual care than men do. So even when the resources are there, they're less likely to use them compared to women. So
That's such an interesting stat. I'm not surprised. I'm not surprised at all to hear that. And, you know, is so looking deeper into it, what are some of the barriers that you think are preventing men from engaging in the healthcare system, knowing that these options are available in your eyes and based on the data?
yeah, I really recommend that folks download the Movember Institute's report on men. It has a lot of interesting information on this topic about a lot of the reasons that men aren't seeking care and why they aren't going into a physician's office. A lot of it is around bias, stigma, lack of access, maybe lack of healthcare literacy. All of these things come into play. But just imagine for a minute. I'm going to just imagine, Rob. You can imagine. You're a man. What do you see when you walk into a physician's office? Toys,
Yeah,
posters
right.
on the wall that are geared towards women. And so you're walking in kind of feeling like, is this environment for me? Generally, the offices are pretty stale looking. And then what's the first thing you do? You go up to the receptionist and they're like, "Hey, Rob, why are you here?"
Yeah,
I
right. And then
intentionally
quickly.
just raised my voice because they're not quiet about it. The studies show that even just having to share with the receptionist why you're there is a barrier to going. When we have environments that don't feel welcoming for people, they don't necessarily want to go in them. And the studies really show for men when the environment is built for essentially women with children, they're going in and they're kind of feeling this place isn't for me. So then you go into that appointment and hopefully that message doesn't get reinforced by your physician, but it might, depending on the issues that you have going on.
I think there's a lot of like we're changing the conversation around healthcare, right? Like again, back to my point earlier, it's always been this like reactive conversation. And I think what's challenging for men and women, for everybody alike, is this idea that like we should actually try to take control and accountability of our health in a preventative way. And I don't know that, we have been conditioned historically to do that. And I think there's conflicting priorities. Like people don't want to take time away from work or from their family. Like the younger generation is kind of making us realize that the hustle culture is not a badge of honor anymore. Working overtime and saying yes and putting too much on your plate. I think that kind of translates into this like preventative seeking care conversation, because sometimes we say things like, "Well, I'm not going to go see a doctor for that," or "I haven't been to a doctor in over 2 years," almost in the same vein. Like it's this badge of honor that I'm just so busy that like I couldn't possibly take time to like just take care of myself. So it's not even just seeking care when you've got a minor acute problem before it becomes something bigger. It's taking that step to seek support, talk about it amongst family or friends or colleagues around things that you should be doing to proactively take care of your health before it even becomes something that you need to seek, a doctor or a specialist for.
The big thing with that is, to kind of just carry into that for a minute, is that most things that kill us later don't have symptoms for a very, very long time. So when it comes to that proactive care, like, oh, I haven't been to a doctor in a decade. Cool. What about your screenings? What about your prostate screening? What about getting your heart checked out? We have a lot of premature deaths in Canada, and Stats Canada calls a premature death a person who passes before the age of 75. And in men, that number is 44% higher than women. And a lot of these deaths are preventable. 135% of them are from or coronary heart disease, like compared to women. So men pass due to coronary heart disease 135% more than women do. That's stuff that we can proactively tackle if you pop into a doctor.
So, and this is such a great takeaway for everybody listening today. Both of you have made some fantastic points, and the importance of you think about what companies should be considering. I think going forward as an action item is your benefit plans got to be looked at proactively instead of where it's traditionally always been reactive. Oh,
Mhm.
rates go up. Let's look at plan changes. Maybe we should get quotes. Those days are dying and people have to realize that. So that proactive measure is so critical, right? So how do you improve people's health and what are strategies that you can look at? So I think that's great. So, when we look at workplace benefits to kind of roll into that topic, are men actually using what's available to them? Are you able to kind of dive down into stats and how men are using the plan versus women are using the plan as an example?
Yeah, we definitely can. To no one's surprise, the women are outpacing the men in usage by a large margin. So Benefits Canada, the healthcare survey they do every year has some great data. They found that 61% of women report maxing out a benefit compared to only half of men. When we dig in a bit more deep on the data, some of the bigger concerns come in and around the mental health care practitioners, where we end up really having like a 60-40 kind of split, where 60% of the usage of the mental health care practitioners are from women, with only 40% from men. And the EAP usage supports that as well. Homewood is our EAP partner, and they have 60% of usage coming from women in the EAP. We know the EAP offers a lot of different resources too. So, yeah, so we definitely see women using the benefit plan a lot more heavily than men.
I think too, like, and that, I mean, that doesn't mean that men need it any less, right? I think one of the biggest challenges that we have in the group benefits industry is just the engagement around the benefit plan. And again, speaking to that like proactive, preventative approach to health and wellness, like people don't know what they don't know, and that doesn't mean it falls solely on the benefit plan or an employer to make employees aware of what they should be aware of, but a lot of the taking accountability of our health is not just going to see a doctor. It's understanding like what should you be screened for based on your age or based on your family history, and what types of services are available, whether it's through, public funding, whether it's through your benefits plan, but also just helping, like I think we as an industry, helping employers know how to communicate those things so that their members, man or woman, can feel engaged to what they have access to, why they might need it, and making it easy to access, whether that's just literally knowing how to access it or removing some of the like the barriers, the stigmas that we've kind of talked about to making men or women feel more comfortable utilizing those services.
Sure.
Mhm.
Absolutely.
I want to take a moment to even like talk about something that is very evident, right? Delay in care will translate into real health outcomes. Whether they're sick or off work, or ultimately, as we said, death could be an outcome when you ignore it, a symptom, or don't even realize you have a symptom. So when we talk about that, what are some of the practical costs, both time off or sickness, that you've seen in when people don't seek treatment early on? Can you speak to that a little bit?
Yeah, I mean the obvious, I mean, and Megan might have more of this of the stats, but like the obvious consequences from a workplace perspective, like reduced productivity and absences that, wouldn't have been as long as they now need to be because somebody went to a doctor earlier and got diagnosed sooner and so got on the right treatment plan sooner, or even addressed a more acute symptom that only became more serious because they delayed seeking care. We're seeing rising costs on disability claims, mental health obviously being the top condition for disability claims. I think there's a number of reasons why there's some delayed care when it comes to mental health, both the access, diagnosis, but also just being able to acknowledge the fact that maybe you're struggling from a mental health perspective. And then you add in, the challenges with our healthcare system. And so if you've delayed seeking care and you've gotten a delayed diagnosis or a diagnosis that has now become more serious, if it's something that requires access to a specialist or to additional testing, the wait times are long. And in some cases, people are going years without getting the treatment or even the first visit with a specialist that they need to get onto the right treatment. And I don't have it here because it was on LinkedIn yesterday, but there was a Benefits Canada or one of the posts that talked about the number of people who died waiting for whatever procedure that they needed.
Yep.
And you got to wonder, if you unpack those numbers, how many of those people, it wasn't just because they had to wait so long, it was because they waited so long in the first place to get the diagnosis, where if caught earlier, maybe a long-term disability claim or death could have been avoided, and it could have just been, a couple weeks off work to get treated and get back to health.
When the next major health policy hits, will you be leading the conversation or caught flat footed by your CFO? Get the distinct, boots on the ground intelligence straight from the legislative table. Subscribe to Advocacy in Action, the official podcast of the SHBA. Search Advocacy in Action right now and don't get blindsided. Yeah, and so I have a follow-up question to this, and this is where we get to some of the juicy nuggets that we come out of here. How do we help employers or plan sponsors, create an environment or communication strategy to encourage proactive and preventative care? Because I'm thinking, and I will probably sound stereotypical here, some men will have a partner at home that is encouraging them or nudging them to go see a doctor. It may be better heard from your workplace, actually, and maybe received well as like, wow, they care about me. Of course your partner cares about you, but
I
the
don't get it.
employer, they hear
Right?
it from the employer. Wow, they care. They want me to do something. So let's talk about
Yeah.
that. Have you heard any best practices or nuggets that we can share with our listeners who, primarily are employers looking to get on this preventative wagon here and help their men in their population?
And I'm going to jump in real quick because I think you, to add to that, I wonder if it's a generational, communication as well, because we know that the younger generation
Yes.
will absolutely be more proactive and open to talking about their health. whether that's their physical or mental well-being, versus certain generations that are not likely to talk about it, not go to doctors. So I don't know if there's dual, kind of communication strategies that Sophia, Megan, you and your teams have thought about, or you need your next, right?
The benefit communication is always the toughest part about the benefit plan because you need that just in time communication, um, which is tough. People aren't necessarily looking for things in the plan. Messages may not land when you don't feel like you need something. So that's why we're always kind of promoting frequent communication. I always say small, frequent bursts, short to the point, but then repetitive over time. When it comes to communicating, though, we kind of need to find people where they are. So, generationally in the workforce, like where are people? Our Gen Z friends and my fellow millennials, like we're on social media. Employers can leverage internal social media channels. You can have a internal TikTok. You can have a Facebook, but you're not going to reach either of those groups there. I only have Facebook for Facebook Marketplace because I live in Victoria and that's where everybody here sells their things. Um, but you can have internal social media and maybe you're hitting people there. Um, we kind of, used to always talk about the lunchroom poster, but what about the washroom poster? Right? Like, let's get information about screenings. This is a place where you can get really specific on a topic. Let's get the screenings up above the urinals or in the stall, notices on what it is, how it is. But I think a big piece that's been missing in communication is the what do I expect when I go to use the thing? So we're saying, hey, you have it. Here it is, here it is, here it is. Maybe we're communicating to you where you want to communicate. Maybe we're using language for men or for women or for this generation. But if people don't know what to expect when they go to use a service like an EAP, it makes it even scarier. Just imagine you have finally gotten the courage to pick up the phone and call your EAP provider. You might be expecting to speak to someone to get help in that moment, but you won't. Unless you're having an emergency, the EAP generally is going to schedule you for the future to speak with someone. And that could be really disheartening and mean that that person either doesn't keep that appointment or, doesn't go back to it to use it. So I think kind of setting expectations up around what's going to happen when you reach out are really important. People might be a little off put that when you reach out to the EAP that like they're doing mental health checks. Like, are you okay? Are you in crisis? And you could be a little surprised by this. Um, and then maybe feel hesitant about using the service in the future. So I think that if we do a bit more around what to expect when you use a service, people will be more likely to have the confidence to then reach out for the help and get it.
I think too, like in communications, I think stats are incredibly important for sure because the proof is in the pudding. But a lot of times people resonate more with stories, right? Or hearing someone like hearing a scenario that's like, oh wait, that's me. I hear that story and or that's my experience. So I think in addition to just communicating, I think creating a safe space for I'm not saying that, as an employer, as an HR manager, you should tell people to come and use your office as a counseling session, but encouraging safe environments for people to share, creating flexibility within the work hours to go see like make appointments because a lot of the times making these appointments it's difficult to do outside of the 9 to 5 and people don't necessarily want to tell their employer that they need a couple hours in the morning to go see their psychiatrist, right? So creating a safe environment where people feel either comfortable talking about those things or have a flexible work environment where they can take those times off to go do those appointments or go to meetings and do the things that they need to take care of themselves. I do think that there's a lot of people and men probably in particular specifically with mental health and mental illness the traditional stories, the stats, the things that are typically used to communicate around mental illness and mental health supports are maybe not the ways in which men internalize how they want to address that, right? And it's probably not just specific to men. I think there's a lot of people that if you find a way to spin the like scary stats into a more positive, preventative, proactive way, like rather than a mental illness, it's mental resilience or it's mental fitness. Like even just small changes like that can make a topic more approachable and get people more engaged with understanding and exploring what supports are out and available to them.
I think that is so critical, Sophia, to say that, and knowing just how men traditionally have been, will be really competitive with each other. We don't want to show a weakness with
Right.
each other. We want to, depending on someone's position, you don't want to show weakness in against with your peers or somebody that, that maybe you're a manager and people are going to make, maybe you're afraid that you're going to be judged differently because of it. And, we've seen that just running, as an advisor, running lots of employee meetings of, group questions, people never ask questions one-on-one, or they'll grab your card and say, "Hey, can I call you later on something?" I'm like,
Yeah.
"Yeah, of course." Then they open up when they're one-on-one and, could be a lot of different topics. So, you speaking around, mental health, you shared some stats with us that are pretty sobering. And, males account for nearly 75% of suicide deaths in Canada. And, as well as the majority of accidental, uh, opioid overdoses as well. So, you know, do you have stats that or, explanations of what do people often misunderstand about how these symptoms typically show up in men? Is it, is there a pattern that is common for in these situations that maybe employers should be aware of or how to approach it differently as we've been kind of talking about?
Yeah, I think a lot of the like symptoms that are classically attached to like things like depression or other mental illnesses is, not going to present the same way in men. Like where, crying and sadness and being withdrawn and removing yourself from social situations, sometimes in men it doesn't present that way. In men sometimes it can be, increased irritability, or maybe they're going to be more they're going to do more risk taking, put themselves in more risk taking situations, or it comes through more as anger, so they're not necessarily withdrawn, maybe they're actually more on than they've ever been before, because it's a different way for those feelings to have an outlet. And I think a lot of the times, because what have been classically attached to those illnesses don't resonate, or men don't hear themselves or see themselves in that oftentimes they're not diagnosed, they're not even aware of the fact that they're struggling with something. And then because more women typically use the mental health services out there, the therapy and the training in that space is also very geared to what classically works for women and the types of symptoms and the ways that they engage with counseling. And there's the Movember report, Megan already called it out. They've done a lot of work on talking about therapy and the types of training and education that therapists go through that are very generalized when it comes to male specific mental illnesses, especially in the space of like suicide and substance use. Like there's very general data and training on that, and not really specifically how to reach men and meet men where they are and create an environment, like a counseling environment, where they feel connected to their therapist, or where they feel that they can speak and acknowledge the feelings that they're having in a way that will actually keep them engaged in therapy. I think there's a lot of men that try therapy. Like if they actually get to a point where they acknowledge that they need help and they go and they seek treatment, they walk out of those sessions feeling like this isn't for me, right? Just sitting and talking about my feelings to somebody, to a complete stranger, is just not going to work for me. So they withdraw and they don't get necessarily the help that they need.
Yeah.
Yeah, that's fair. I could say that knowing people that have been through counseling is that they wanna, "Did I get a result today? Did I move
Hmm.
the needle today? And if I
Hmm.
didn't, I'm not coming back. And if I
Right.
did, then you gotta find your way to engage me." I think that's well said.
Yeah,
Yeah.
and that practitioner fit is vital when we're talking about mental health practitioners. You might need to interview several counselors before you find a fit. And it's just like another extra step to getting help when you're already struggling. And people might try once and then be like, yeah, that wasn't for me. But if they just had a different counselor who connected with them, they would have had a completely different experience and then stayed on you know, continued on with the sessions. So it's a big challenge.
As I was listening here, I was thinking about one key element, change in behavior. And when I think about, Rob, we've talked about the importance of those frontline people leaders, and I'm sure Sophia and Megan, you agree that that's where people are going to who know you best. The managers and the leaders that work with a team can see change in behavior, and that's a sign, whether it's, not your traditional change in behavior necessarily. So, what I'm hearing is that training for people leaders, even to observe that change in behavior and then to take that step of checking in with people is so critical for anyone on the team, really. But most important, it sounds like for men as well. As we draw to a close on our podcast today, I could go on to episode number 2, I'm sure. But is there anything else that you want to make sure that our employers and plan sponsors, what would be one more action or mindset shift that you would offer up to our listeners?
I think there's a lot of great ways to support everybody in the benefit plan. And if employers want to do the smallest of actions, I think it's just promote the screenings. And if they want to get a bit more, deep in it, then you're going to get into cultural changes, supporting people at work. Do we have pat leaves? Do we have the right drugs? Do we have ED drugs on the plan? Do we have vaccines on the plan? Do we have fertility on the plan? Not everything needs to be a costly change. Uh, yeah, I think it's just you kind of need to decide how do I want to support the workplace, and then take steps from there.
Good stuff. Sophia?
Yeah, I think I would just add like know your workforce, right? Understand the demographics, the people, their needs, and understand your benefit plan as well and what is already there that just maybe needs to be repositioned or recommunicated. Like in most cases, you don't need a brand new shiny product, right? You don't need to spend a ton of dollars on enhancing the plan. It's just how you are positioning what's available, why it's important to the people you're speaking to, and make it easy for them to access it and to want to talk about needing those supports.
Yeah. Yeah. I've said to companies for years, whether you have 5 employees or you have 5,000 employees, you manage your admin costs, you manage your claims costs, or you try to make people healthier. Those are
Mhm.
your 3 buckets when it comes to controlling your benefit premiums you pay. And it's important to everybody these days. We super get it, right? That everything's gotten more expensive in this world. But if you can find strategies to help people proactively take care of your health, and as are all the guys listening right now, when you're young, you sacrifice your health to build your wealth. And then when you get older, you're going to unfortunately have to sacrifice your wealth to probably try to get that health back.
Mhm.
So why don't try to proactively manage your health while you're in good shape and take those proactive screenings, which a lot of them are covered already by our preventative health plan, so it's not out of pocket. So that I think of the only thing I'll add, and I totally agree with everything both of you are saying is, yeah, you might have to physically provide that information to people, that, hey, if you're in your 30s, here's what you should be worried about. If you're in your 40s, here's what you should be worried about. If you're in your 50s, likewise. So I think providing that information right to somebody is at least an option that you're going to try to lead somebody to that water to drink as an example. So
Mhm.
yeah,
Yeah, and we'll be sure to include in our show notes as well the resources that you provided and the links to the report that you mentioned. I think it's a valuable place to start and some great reading. But I want to thank both of you, Sophia, Megan, for being on the Benefits Alliance Voice today and helping us shed some light on men's health and supporting better health outcomes.
that's great. Thank you, friends.
Thank you.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.